Hi, this is Chandler Rose, and this is part of my Trigger Point series that you can find on WellnessPlus.tv. And today I'm working on the knee and any issues involved with knee pain. Also great for runners, athletes, anybody that's had knee surgery. These trigger points are very good for relieving pain and tension in the leg above the knee. All right, let's get started. So first I'm going to apply my very nourishing hemp oil salve. And I'm gonna show these techniques a little bit on both sides because of where the cameras are. But it's best if you're doing trigger point to sit on the side that you want to address first. And I'll point out these points on the other side as well so you can see exactly where I'm positioning. Also important with any kind of knee body work to have the knees elevated. And you want the feet about hip width apart, so get your person in a comfortable position on a mat or blanket with the knees elevated. You can also use a pillow. If you have someone with deep knee pain or hip pain, you might actually want to elevate the knees more with a couple pillows. So experiment with that. Just make sure your person is nice and comfortable. So a trigger point is deep work, specific work designed to address pain and referral sensation. I think it's very important to warm the tissue before doing deep trigger point work. I'm going to be working on the quadriceps, which a lot of times are involved in creating more pulling above the knee. So I'm starting just by loosening with some palmar pressure and pushing in and up towards the head, moving the blood that direction and warming the tissue. It's also important to point out that this area here, where the IT bands are, or the TFL, it's dense fascial tissue that is very nervy. So anytime you're doing trigger point in this area, you want to really reduce your pressure at least by half. And people that are runners or athletes might be foam rolling, which is also really good for this kind of work, because it can help open up that fascial tissue before going in and doing trigger point. But just good to know that even the average person has deep tenderness in this area, just the nature of that tissue. So I'm gonna start by addressing trigger points above the knee on the lateral side, vastus lateralis. It's a muscle that runs in this region and connects into the knee. And for trigger point, you can either, if you're comfortable, you can use one thumb, or I like to be in a position where I have my thumbs stacked. And the best position is to be on the side you're working on, because then you can kind of push in towards the midline. But just so you can see it, this is where I want to be here. And trigger points can range from just above the kneecap or the patella all the way up into the quad. And a true trigger point will offer a referral sensation, which is a pain that radiates from that point and shows up somewhere else. So you can communicate about that with your person if they're feeling referral. And I'm going to do a few of those points here on this side. And just pushing down into the quad. And you want to hold that point for 5 to 10 seconds to start. And how is that pressure feeling for you? Okay. So you want to work at a level of change which is uncomfortable but not too painful. You also want these points to feel like they're melting under your thumbs. Knee pain can show up from a lot of different types of postures or activity or injury, but I find a lot of it has to do with tension in the quads and also tension in the inside of the knee or the back of the knee and the hamstrings. So after I address some of these trigger points here in the quad, vastus lateralis, vastus intermedius, which are these tube-like muscles that run in this region, I'm going to show you some other points on the back of the knee, which are also helpful. It's also good to mention I have some self-care, self-massage videos, but this work can also be used for self-massage. I find it's easy to do if you're seated and you have your knees in a comfortable bent position, and then you can kind of work with this area on yourself, especially if you have knee pain. And I'm just going up, so vastus lateralis runs on the side, and then there's another one that runs in the middle, so I'm on that middle tube-like muscle above the knee. And trigger points should involve a certain amount of breathing from you and the person you're working on. So you want the pace to be breathing in to the count of 5 and out to the count of 12. Really slow exhale allows the body to integrate that deep point work. And then after a few minutes just working on points, you always want to go in and do a little more relaxation work just to allow that person to have a break. Trigger point work can also cause some soreness when it's over. And sometimes when I do self-care, self-massage on myself, I can actually leave a little bruise here and there, which is not very uncommon. So just, you want to be careful, but trigger point work can cause that to happen. So don't be alarmed if you get a little bruising. You just want the deeper tissue to feel more relaxed. And sometimes it's the adipose tissue that, or the skin that reacts in that way. So I'm going to go in the midline and do a few more points there. An interesting part about trigger points, especially in the leg, is you can have very interesting referral sensations. You can have them above where you're working or just radiate out from where you're working. You can have them show up in the knee or the back of the leg or into the hip. And all of that is just a good indicator that you are working on a mechanism that is controlling a certain amount of movement and involved in that kind of movement. So referral is just a really good indicator that you're doing good point work. Also find I have a lot of people that have had either a knee injury or surgery, so there can be scar tissue. Trigger point work is also very effective on scar tissue. It can feel a little numb where you're working to the person, or it can feel more tender. But overall, what you're doing is increasing space in the area, which can really help someone that's had an injury or surgery, because the body will go down and lay tiny fibers of extra tissue there, which can cause less range of motion, more tension or felt tension. So if you can go in and work on scars, and you want to make sure they're not any new scars. I would say after 3 months after a surgery, a scar is pretty safe to get some trigger point therapy on it, especially around the knees. That can really help. And I'm just going down towards the attachments. A lot of times here and here are these small ligaments that respond well to massage or a trigger point, depending on the tenderness level. So I'm just going to massage those attachments with my thumb and fingers. And then another good place to position is just above the knee. This oil blend I'm using is also very nourishing for muscle spasm or muscle cramping. It has organic plant extracts supportive of muscle cramping. It also has magnesium and arnica, also natural remedies for inflammation or pain. So using a really good natural oil or oil blend is helpful for this kind of deep tissue work. Our bodies are porous, so our pores will absorb some of that medicinal oil, and it all helps relax the whole being, which is what we're trying to do. So after I've opened up vastus lateralis and the middle area just above the knee, I like to go around the patella and just check in with my thumbs. And you can do some trigger point in the meaty area below the kneecap. So I'm actually gonna move over so you guys get a better view. And what I'm doing is I'm giving her pressure under her kneecap on this lateral side. Again, really good for anyone that's had either degenerative knee issues or surgery. A lot of times you'll see a scar, or hopefully that will be communicated, but working in this area can really help the overall health of the knee, just giving that kneecap pressure. And a trigger point is going to feel more like a specific nodule that you can work on with the pain attached to it. But some of this in the knee often just feels a little bit to me like congestion or inflammation, which feels a little bit almost crunchy to the touch. So with the knee, you're really just looking to loosen that crunchiness around the knee so the whole knee joint can relax. And with the nourishing oils, I'm also allowing her body to take in some of that good that good medicine that helps with inflammation, like the magnesium or the arnica or the essential oils. So now I'm on the inside of this knee, and if you feel a really tight kind of juicy area where the person is feeling some pain, you can stop there and just sit for a second, 5-10 seconds. And you can even go directly on the kneecap. It's also good with any trigger point. I always like to space it out. So you do 5-10 minutes of trigger point, and then maybe you just want to go in and increase mobility. And a good way to gently do that around the knee is to position the hand so one hand is above the kneecap and one hand is below. And then you're gently just moving that patella from side to side. And in some of my older clients, they really appreciate this specific work in the knee. A lot of knee pain can come up as we age, and subtle massage around the kneecap or the patella can really help with that joint pain. And you can take your fingertips and do circles. And if you're feeling a little popping or a ligament, you can always just sit on that for a second with your fingers and hold it. And breathe. Your own breathing is a reminder for the person you're working on to connect with their own breath. So I've worked vastus lateralis, vastus intermedius. I've loosened the muscles and ligaments around the patella on this side. And now I'm just giving her some Swedish massage to lengthen and relax this area as I close out this portion of this knee treatment massage. I'm going to finish up on the anterior leg for the knee, and you can refer to part 2 of this video to help with knee pain, where I'll be working on the muscles inside of the knee and the back of the knee, and she'll be laying face down. I hope to see you there, and I hope this helps you. Thanks a lot for watching.
We at WellnessPlus specialize in all things health and wellness, ranging from yoga and fitness to massage and ASMR. Whether you are looking to target specific areas of tension or want to enhance your general self-care routine, we provide the tools you need to feel better, look better, and live better. We have courses for every level, whether you're just starting out or you're a seasoned pro. Our courses provide a wide range in difficulty to accommodate your evolving flow.
Welcome back to Yoga with Jess. We are going to break down some really essential postures.
We are going to rock out with some of the most essential ab exercises that you need to have the abs that you've always dreamed of.
I've blended techniques to help you connect with students, and you can be a rock star teacher.
WellnessPlus is available on your phone, tablet, or TV. Join WellnessPlus today and get your first 7 days free.